Your Journey to Becoming a Nurse, a Complete Guide. Chapter 1. Decoding the RN Landscape, Your First Steps Toward a Nursing Career. The rhythmic beep of a heart monitor. The hushed urgency in a doctor's voice. The quiet comfort you offer a frightened patient. This is the world of a registered nurse. A world brimming with challenges, rewards, and a profound sense of purpose. But how do you navigate the path to becoming one? That's the question we'll explore in this audiobook. Becoming a registered nurse, RN, is a journey, not a sprint. It requires dedication, resilience, and a clear understanding of your options. Nurses are vital members of the healthcare team, performing a diverse range of duties. You'll find them in bustling hospital ICUs, tranquil pediatric wards, busy operating rooms, serene outpatient clinics, and even unique environments like cruise ships or schools. Their responsibilities extend far beyond just giving medications. They include vital signs monitoring, thorough patient assessment, including initial visual inspections, and assessments of respiratory, cardiovascular, abdominal, musculoskeletal, neurological, and integumentary systems. They also handle wound care, patient education, and play a crucial role in coordinating care with a wide network of healthcare professionals, physicians, respiratory therapists, nurse practitioners, and many more. Think about it. You're not just administering medication. You're managing a patient's entire well-being, from monitoring vital signs like blood pressure, heart rate, and oxygen saturation to performing procedures such as IV starts and Foley insertions. There are 5 primary pathways to becoming an RN: the Associate Degree in Nursing, ADN, the Bachelor of Science in Nursing, BSN, diploma programs, accelerated programs, and master's entry programs. The ADN program, typically completed in 2 to 3 years, though realistically closer to 4, including prerequisites, offers a faster route, often through community colleges. The BSN program, usually a 4-year undertaking at a 4-year university, provides a broader educational foundation. Diploma programs, though less common now, still exist and offer a focused, hands-on approach. Accelerated BSN programs, ideal for those with prior bachelor's degrees, condense the curriculum into 12 to 18 months of intensive study. Finally, master's entry programs provide a pathway for individuals with non-nursing undergraduate degrees to transition into the profession. Before you choose a path, however, it's crucial to conduct a thorough self-assessment. What's your learning style? What are your financial resources? What are your career aspirations? Do you envision yourself in a fast-paced emergency room or a more specialized field like pediatric ICU? These questions, and many more, will guide you towards the most suitable path. Understanding yourself is the first step towards success. Now, let's delve into the specifics of each educational pathway to help you make the right choice for your future. Chapter 2. Navigating the Educational Maze. Choosing the right nursing program. Imagine this. You've spent countless hours studying, sacrificing sleep, and pushing yourself to the limit. The reward? The satisfaction of knowing you've chosen the right path and are one step closer to your dream career. But choosing the right path requires careful consideration of the different programs available. Let's start with the Associate Degree in Nursing, ADN, programs. While often advertised as a 2-year program, realistically, including the necessary prerequisites like biology, chemistry, anatomy, and nutrition, it takes most students closer to 4 years. These programs are frequently offered at community colleges, making them a more affordable and accessible option for many. However, remember that ADN graduates often face limitations in career advancement compared to BSN graduates. The Bachelor of Science in Nursing, BSN, program is a 4-year commitment, typically at a 4-year university. It offers a more comprehensive education, including a broader liberal arts foundation and greater opportunities for specialization and leadership roles. While the initial investment is greater, the long-term benefits in terms of career prospects and earning potential often outweigh the costs. For those with prior bachelor's degrees, accelerated BSN programs offer a rapid route to an RN license. These programs are incredibly intensive, condensing the curriculum into just 12 to 18 months. While demanding, the accelerated format allows a quicker entry into the profession and can be a financially strategic choice. Diploma and certificate programs, while less common, still exist. They generally take 2 to 3 years to complete and offer a more hands-on, practical approach. However, career advancement opportunities may be limited compared to ADN or BSN graduates. Finally, for those with backgrounds outside of nursing, master's entry programs provide a pathway to becoming an RN while earning a master's degree. These programs typically include additional coursework focusing on leadership and management skills. The choice, ultimately, is yours. Each pathway presents its own advantages and disadvantages. Choosing the right one depends on your individual circumstances, financial resources, and career aspirations. Careful consideration of these factors is crucial for a successful journey. But choosing the right program is only the first hurdle. What about the prerequisites? How do you prepare yourself for the rigors of nursing school? Chapter 3. Mastering the Prerequisites. Preparing for nursing school success. The weight of expectation. The mountain of textbooks. The relentless pressure of exams. Nursing school is a demanding experience, and success hinges on solid preparation. It all starts with mastering the prerequisites. Essential prerequisite courses commonly include biology, chemistry, anatomy, nutrition, and often microbiology and statistics. These courses provide the foundational knowledge necessary for understanding the complex human body and the intricacies of disease processes. Students frequently report struggling with chemistry and anatomy, highlighting the importance of dedicated study and effective time management. Several accounts detail the challenges faced, emphasizing the necessity of seeking help when needed and adopting robust study techniques. One student, for instance, highlights the importance of a strong work ethic, emphasizing how she was more disciplined in her studies as an older student than she had been earlier in life. A strong GPA is paramount. Admissions committees place significant weight on academic performance, with some programs targeting students with a 4.0 GPA. This underscores the need for dedicated study habits and consistent effort. The importance of a strong GPA cannot be overstated. Many nursing programs also require entrance exams, such as the ATIT's exam, to assess your readiness for the rigors of nursing school. These exams evaluate your knowledge in science, math, and reading comprehension. Preparation is key to succeeding on these exams, and utilizing available resources like practice tests and study guides is highly recommended. Consistently high performance in prerequisites and entrance exams are critical steps toward gaining acceptance into your chosen program. Remember, this phase is not just about getting in. It's about setting yourself up for success once you are in. So, you've aced your prerequisites and entrance exams. Now, the next challenge awaits: navigating the application process. Chapter 4. Conquering the application process. Getting into your dream program. The anticipation, the nervous excitement, the sheer relief of acceptance. Getting into your dream nursing program is a significant achievement, and the application process itself can be quite daunting. First, understand the requirements. Many programs demand essays, resumes, and letters of recommendation. For instance, UCLA's application might require a 3 to 4 page essay, while UCI may ask for a shorter, 250-word response. These documents offer a chance to showcase your strengths and personality. Mentioning experience as a certified nursing assistant, CNA, for example, is a significant plus, as it demonstrates practical experience in a healthcare setting. A previous bachelor's degree can be crucial in securing a spot in an accelerated BSN program. Highlight your strengths. What unique experiences or skills do you possess? What makes you a suitable candidate? Do you have relevant volunteer experience, a strong academic record, or leadership skills? These are the aspects you should emphasize. Networking is crucial. Connecting with current nursing students or alumni can provide valuable insights and perspectives. These connections can be invaluable in gaining first-hand information about the program and gaining a competitive edge. Rejection is a possibility. Don't let it discourage you. Many applicants apply to multiple programs, facing rejections along the way. Persistence and resilience are essential qualities for aspiring nurses. The application process is a marathon, not a sprint. It demands patience, determination, and a willingness to learn from setbacks. Remember, your dream is within reach. With your application submitted, the next phase begins: navigating the intense demands of nursing school itself. Chapter 5. Surviving and thriving in nursing school. Mastering the demands of the profession. Sleep deprivation, endless studying, high-stakes exams. Nursing school is notoriously demanding, requiring exceptional time management, stress reduction techniques, and unwavering dedication. Many students report working 40 hours a week while enrolled in accelerated programs, highlighting the need for efficient time management strategies. Several accounts detail the challenges of sleep deprivation, emphasizing the importance of self-care and maintaining a healthy work-life balance. The pressure of weekly tests and high-stakes exams is a constant, often leading to feelings of overwhelm. Students often form study groups and utilize tutoring services to support their learning. Effective study habits are crucial. Active recall, spaced repetition, and practice questions are invaluable tools for mastering the vast amount of information. One student recounts failing a course with a C grade, emphasizing the high standards expected in nursing school. Another student highlights the importance of consistently high performance, ultimately graduating with highest honors. Utilizing available resources is essential. This includes seeking help from professors, tutors, and study groups. Building a supportive network of peers and mentors can make all the difference in navigating the challenges of nursing school. Maintaining mental and physical well-being is vital. Stress management techniques such as exercise, mindfulness, and adequate sleep are crucial for preventing burnout and maintaining focus. Nursing school is a marathon, not a sprint. Pacing yourself and prioritizing self-care is paramount for success. You've survived the rigorous demands of nursing school. Now, the ultimate test awaits. The NCLE-XRN exam. Chapter 6. Passing the NCLE-XRN, Securing Your Nursing License. The tension in the air. The quiet hum of the computer. The weight of your future resting on your shoulders. Passing the NCLE-XRN exam is the final hurdle before becoming a licensed registered nurse. The NCLE-XRN, National Council Licensure Examination for Registered Nurses, is a comprehensive exam that assesses your knowledge and critical thinking skills. It covers a wide range of topics, including medical surgical nursing, pediatrics, maternity, mental health, and community health. The exam is computer adaptive, meaning the difficulty of the questions adjusts based on your performance. Effective preparation is key. Many students use study materials such as the U-World program, spending hours each day working through hundreds of practice questions. One student describes a regimen of 100 questions a day during their NCLEX preparation. Mastering test-taking strategies, such as eliminating incorrect answers and managing time effectively, is also crucial. Not everyone passes on their first attempt. One student recounts failing the NCLEX, then successfully passing on their second try, highlighting the importance of perseverance and learning from mistakes. The experience of failure can be a powerful teacher, and refining your study approach is key for a second attempt. Once you pass the NCLEX, the licensing process begins. This involves obtaining your license from your state's Board of Nursing and adhering to all relevant regulations. The licensing process varies by state, but generally involves submitting applications and background checks. For nurses planning to work in multiple states, understanding the licensing requirements of each state is crucial. In the UK, for instance, all nurses must register with the Nursing and Midwifery Council, NMC, to practice. Securing your nursing license marks a significant milestone. But the journey doesn't end there. The next chapter involves securing your first nursing job. Chapter 7. Landing your first nursing job, Navigating the Job Market. The thrill of graduation. The excitement of starting your career. But landing your first nursing job requires strategic preparation and effective job search techniques. Building a strong resume and cover letter is crucial. Tailor your applications to each job, highlighting the skills and experiences that align with the specific requirements of the position. Mentioning any relevant certifications, such as ACLS, PALS, TNCC, or basic cardiac rhythm, can boost your candidacy. Mastering interview skills is equally important. Prepare for common interview questions and practice articulating your strengths and experiences. Showcase your passion for nursing and your commitment to patient care. Negotiating salary and benefits is a vital aspect of securing a favorable employment package. Understanding the average salary range for your area and your specific role is crucial. Factors such as shift differentials, night shift, evening shift, weekend shift, can significantly impact your overall earnings. For example, a new graduate registered nurse might start with a base pay of $38.75 per hour, with additional differentials adding substantially to their hourly rate, potentially reaching $41.25 or even $43.50 depending on the shifts they choose. Many hospitals offer new graduate residency programs, providing additional training and support during your first year. These programs can be invaluable in easing the transition into the professional world and providing mentorship from experienced nurses. A 3-month new grad residency program, for example, might include a month of classes and provide valuable on-the-job training. Securing your first job is a significant achievement, but it's merely the beginning of a long and rewarding career. What does that first year, and the years beyond, hold? Chapter 8. The First Year and Beyond, Thriving in Your Nursing Career. The reality of your first job can be both exhilarating and challenging. Setting realistic expectations is crucial. The transition from student to professional nurse is significant, and adapting to the demands of the workplace takes time and patience. One new graduate describes the challenges of working in a pediatric home health setting, caring for medically fragile children, while another recounts their experiences in the demanding environment of a surgical ICU. Building strong professional relationships with colleagues and other healthcare professionals is essential for success. Collaboration is key in providing optimal patient care. Nurses work closely with physicians, respiratory therapists, and other specialists, requiring effective communication and teamwork. Continuing education and professional development are vital for maintaining competency and advancing your career. Opportunities abound, including RN to BSN programs, MSN programs, and specialized certifications. Obtaining certifications such as CCRN, Certified Critical Care Registered Nurse, can enhance your career prospects and earning potential. Challenges will inevitably arise. Managing stress, dealing with difficult patients and situations, and seeking support when needed are crucial for long-term success and job satisfaction. Creating a strong support system, both professionally and personally, is essential for navigating the emotional and physical demands of the profession. Your first year is just the beginning. The possibilities for growth and advancement are vast. What advanced practice opportunities might lie ahead? Chapter 9. Advanced Practice Opportunities, Exploring Career Paths Beyond the RN. The possibilities are endless. A career in nursing is not limited to the bedside. Many nurses pursue advanced practice roles, offering greater autonomy, specialization, and often, higher earning potential. Nurse practitioners, NPs, provide comprehensive healthcare services, including diagnosis, treatment, and management of chronic conditions. The educational pathway to becoming an NP typically involves completing a master's or doctoral program in nursing. The length of these programs varies, and costs can range from around $18,000 for in-state tuition to over $45,000 at private universities. The average annual compensation for NPs is substantial, often exceeding $100,000 and reaching significantly higher in specialized areas. Certified Registered Nurse Anesthetists, CRNAs, administer anesthesia and provide pain management. This highly specialized role requires completing a master's or doctoral program in nurse anesthesia. The earning potential for CRNAs is exceptionally high, often exceeding $180,000 annually, with some areas reporting considerably higher salaries. Other advanced practice roles include nurse educators, nurse midwives, and nurse managers. Each role offers unique challenges and rewards, requiring specific educational requirements and certifications. Nurse educators, for example, often require a master's or doctorate degree and considerable experience, while nurse managers benefit from an MBA or healthcare administration degree to complement their nursing background. The path to advanced practice requires dedication and significant investment of time and resources. However, the potential rewards in terms of career satisfaction and earning potential are substantial. But before we explore the advanced practice options further, let's address the often overlooked but vitally important aspect of finances. Chapter 10. Financial Considerations, Managing the Costs of Nursing Education and Building Your Career. The financial burden of nursing education can be significant. Understanding the available financial aid options is crucial for managing the costs. Scholarships, grants, and loans are available to help offset tuition expenses. Many organizations offer scholarships specifically for nursing students, and colleges often provide work-study programs to help students finance their education. Some hospital systems offer tuition reimbursement programs, providing financial incentives for employees to pursue advanced education. Student loans, while a common source of funding, necessitate careful planning and responsible debt management. One student recounts receiving $50,000 in student loans, emphasizing the importance of responsible borrowing and repayment strategies. Understanding nursing salaries and benefits is essential for long-term financial planning. Salary ranges vary widely depending on location, specialization, and experience. Negotiating compensation and maximizing earnings through shift differentials and overtime pay are important considerations. Long-term financial planning is crucial for a successful nursing career. Considering factors such as retirement savings, insurance, and debt repayment is essential for securing financial stability. Managing the financial aspects of nursing education and career development is a crucial component of success. With a solid financial plan in place, you can focus on your studies and your career without undue financial stress. And now, let's broaden our horizons to consider international opportunities. Chapter 11. Global Perspectives on Nursing Careers, International Opportunities and Experiences. The world needs nurses. The global demand for nurses is substantial, offering exciting opportunities for those seeking international experiences. Becoming a registered nurse in other countries involves navigating varying licensing and certification requirements. For example, working in the UK requires meeting specific educational and competency standards, including English language proficiency tests and registration with the NMC. Similarly, working in New Zealand or Australia involves meeting their respective immigration requirements and passing competency exams. One nurse recounts their journey from India to New Zealand, detailing the challenges of meeting immigration requirements and securing a position. Another nurse describes their experience securing a 4-year scholarship visa in Australia, highlighting the competitive nature of the process. International nursing careers present unique challenges. Language barriers, cultural differences, and differences in healthcare systems require adaptability and resilience. The process of obtaining international work visas can be complex and time-consuming. Despite these challenges, the global demand for nurses offers rewarding career opportunities and the chance to experience different cultures and healthcare systems. The ever-increasing world population, projected to reach 9 billion by 2050, only underscores the growing global need for skilled nurses. While the challenges are real, the rewards and opportunities are substantial. But beyond the practicalities of the profession, what are the personal rewards and challenges of nursing? Chapter 12. The personal side of nursing, resilience, compassion, and career fulfillment. The emotional toll, the physical demands, the long hours. Nursing is a demanding profession, requiring resilience and unwavering compassion. The emotional and physical demands of nursing can be significant. Working long shifts, dealing with critically ill patients, and witnessing suffering can take a toll. Maintaining mental and physical well-being requires prioritizing self-care and seeking support when needed. One nurse describes working 12-hour night shifts, while another recounts the emotional challenges of caring for patients in a pediatric ICU. The rewards are equally profound. The ability to make a positive impact on patients' lives, provide comfort during times of distress, and witness moments of healing and recovery is deeply fulfilling. Building strong relationships with patients and their families creates a profound sense of connection and purpose. Finding mentorship and community support is essential for navigating the challenges and celebrating the triumphs of a nursing career. Connecting with experienced nurses, seeking guidance from mentors, and building a supportive network of peers can provide invaluable support and encouragement. A nursing career evolves over time. The experiences, the challenges, and the rewards shape you into a compassionate, skilled, and resilient professional. It's a journey of continuous learning, growth, and profound personal fulfillment. The path to becoming a successful RN is challenging, but the rewards are immeasurable, both personally and professionally. The beep of that heart monitor, the hushed urgency, the quiet comfort you offer, these become the soundtrack of a life dedicated to caring for others. And that, ultimately, is the most rewarding aspect of all.